Greetings, everyone, and thank you so much for joining us today for the Green Couch Conversation. I am Christine Russell, Director of Health and Wellness Programs here at the Foundation for Black Women's Wellness, joined by our illustrious CEO, Ms. Lisa Payton Kerr, who's joining us virtually from our Richmond, Virginia office, and Erin Bailey. She is our Director of Research and Evaluation. And the three of us are here today to talk to you about our upcoming Wear Pink Day event this Saturday, October 28th at 11 o'clock at Madison College, the South Goodman campus, right there off of Park Street. So one of the main reasons why we are hosting this event is because it is imperative that we as a Black community, Black women in this community, are focusing and prioritizing our health and our well-being, that we are aware of our risk factors and preventative measures that we can take to make sure that we are fighting against breast cancer, not only within our own household, but together as a community. So Lisa, I'll pass it to you to talk a little bit about your thoughts on Wear Pink Day and why people should attend.
Yes, absolutely. Welcome everyone to Green Couch Conversations. Thank you, Christine, for that wonderful introduction. We need you all to come out to Wear Pink Day this Saturday, as Christine said, at Madison College South to talk about breast cancer together as Black women in a community. We know that breast cancer disproportionately impacts Black women, and though we're less likely to be diagnosed with breast cancer, we are more likely to face more devastating outcomes from breast cancer, higher mortality rates, more aggressive forms. And so it's really, really important. And it really is a priority at the foundation to provide education because we know prevention and awareness are key to saving our lives. We all know someone who's been impacted by cancer, by breast cancer. I can name several women on two hands and more who've been impacted and some who've lost their lives. But breast cancer is not a death sentence. And that really is the message that we're trying to convey through this Saturday's event. Knowing your risks, as Christine said, understanding resources, understanding lifestyle habits that we can implement day to day that reduce our risk. And even if we get that diagnosis, if we get that news from a doctor that we have breast cancer, there are so many things that we can do to increase our chances of survival. And we have wonderful speakers who will be present, who are survivors, who will demonstrate what early detection does in the course of saving our lives, preserving our lives. And so we're very excited about that. We all have personal stories as well. I usually don't share as much, but I think in this case it's very important. I had my own breast cancer scare about 4 years ago. I try to be faithful with my annual mammograms. I'm 51 years old and I've been doing them for several years now. And we know that it is a recommendation that Black women start earlier in our efforts to be preventative and potentially detecting and doing many, many things, which Erin will talk about in a moment. So when I went in for this routine mammogram, something was discovered that was odd and unusual, a growth on the left side, my left breast. And I had to go back repeatedly, about 5 or 6 times to have this analyzed. And it was the most fear-inducing experience of my life to not hear the words, "You're all clear," after the first or second visit. And the conclusion was there's something there that we need to watch, right? Thankfully, it was not anything at that time that was diagnosed as a concern for treatment, but I absolutely have to be diligent and being very intentional in doing my mammograms and doing all the things that I need to do to prevent the onset. So we are going to talk about those stories. Oftentimes we get lost in day-to-day life with the busyness of all the things, the priorities that we have, but we have to pause. And I want each of you who are listening to ask yourself, have I paused to schedule my mammogram? Have I paused to do my own exam. And I think Erin's going to give us updates on new recommendations or best practices for detection and all the things you can do at home and what you need to seek a provider to do. And at the end of this, perhaps we'll also share some resources. If you need care or you need additional information, you can always call the foundation, and we are here to help you identify the ways that you can protect your breast health. So with that, Erin, I believe is next up.
Thanks for all that wonderful information introduction, you all. We're so excited to be sharing the knowledge and wisdom that is embedded in our own community here in Madison, Wisconsin, and in Dane County. We want to welcome a wonderful keynote speaker who will be coming to Wear Pink Day this weekend, Dr. Nikki Owusu Brackett, who is a new Black surgical oncologist here at the UW Carbone Cancer Center and UW Breast Center. And we're so excited to have her as our keynote, where she'll be able to share some information about prevention and screening and what that means around breast cancer, and particularly for Black women. It's especially important that we know, as mentioned, we are more likely to die from breast cancer and from more aggressive forms of the disease. And so understanding your own body, having breast self-awareness, understanding when to start mammography screening, and why it's important to understand what follow-up may look like for yourself, as Lisa talked about. Follow-up is actually pretty normal. I'm only, how old am I? 42. I've been having mammograms since I was 26 because I'm in a high risk category. And so understanding that there may be follow-up is an important understanding for what healthcare looks like for Black women. Knowing what to say to your doctor about when to start mammography screening or what has changed in your health history, your family history, is vitally important. We want to make sure that you have the tools and are equipped to have conversations within a doctor's office so that you're prepared to take charge and take ownership of your own health and ensure that the health system is working for you. So, in addition to that featured speaker, we'll also have our survivors and thrivers present in the space with us, as well as speakers. And we want to make sure that we're honoring those that have come before us and made sure that we know that they're important and they have their own testimonies and stories that help drive our work here. Each person in this little session today has their own personal story that we've all been affected in one way or another by cancer, whether it be personal or through family or friends. And we want to ensure that those voices are raised up and heard in a space that is welcoming to them and that honors their own trajectories and stories. And so we can't wait to hear these stories and hope that you hear yourself inside of the stories that are shared so that you know what to do when you go to the doctors next. We'll also have a little pre and post test so you can show us what you know, as well as a pinky promise pledge. Let us know that you're going to be getting your mammogram if you're within, pink and pinky promise pledge to let us know that you're ready to get your mammogram, or have a conversation with your doctor, or go as a buddy with a family or a friend. Family member or friend that needs a little bit of support. And so we're super excited again to have you. Now, space is limited, so we want to make sure that you get signed up in the next 2 days so we can hold a space for you. And I'm going to go ahead and pass it back to Christine to close us out.
Thanks so much, Erin. Thanks, ladies. So as Erin said, registration ends tomorrow, Wednesday, October 25th at midnight. So we are creeping up there in the numbers, and we want to make sure that you are there. So go ahead and register at ffbww.org/wear pink, and we'll put that link down in the description, up in the description, to make sure that you have easy access to that. In addition, if you are unable to attend, we have an opportunity for you to still engage. So if there is a loved one that you would like to recognize and honor who has fought and survived the battle, or has been taken too soon, there is going to also be a link where you can include their name and a photograph so we can honor them as a part of the program as well. Thank you all for your time today. We look forward to seeing you. Yes, Lisa, any last words?
Last word, we want to thank our generous sponsors, of course, who are making this year's event possible. This is our first annual. We're very excited and very grateful to the Wisconsin Well Woman Program and the Pearl Milling Company. Sponsors like these help us to keep this education free and no cost to our community. As you all know, it is our commitment to empower a generation of well Black women and to make our education accessible to all. So thank you to our sponsors.
Thank you so much, everyone. We'll see you on Saturday.
Bye.